Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. And today's our day that we're doing a flash gift card sale. So for those who are just joining, I specialize in scars, in pigmentation, in acne, and also in anti-aging. So I want to showcase, first I'll start with this particular result, but I have a few different ones I'm going to showcase for today. And just go through, walk you through the process of how I do these treatments, and take advantage of it. So it's the last day. It was a flash sale that we ended up doing. We added it on. We had 12 days of deals, and then we just threw this in there at the very end. So you guys could take advantage of it just on our website. And I'm going to make sure everybody can hear me now. Hopefully everybody can hear me. Earlier they were having trouble. Let's see. Hopefully it's okay. Let me know if you can't hear me, because it was a problem earlier. I had to reset it. If you can, awesome. But I'll continue on. Basically, this is a patient that we ended up doing with collagen stimulating products. This is with a dilute form of Radiesse. In this case, hi Michelle, how's it going? Hopefully you can hear me now. Hopefully. It was hopefully, I'm not sure. Nobody's giving me feedback yet. Okay, perfect, awesome. So I guess I hit something earlier to knock off the mic. But yeah, so today's our day that we threw this in as a last minute deal, because I had mentioned it last week that someone was asking if we should do a gift card sale, and we were kind of going back and forth with it, but there was a lot of people that were messaging us about it. So we ended up doing it at the very, very end of our 12 days. We did the 12 days of deals last week, and then we threw in the gift card deal. So this is the best deal that you could possibly get all year round. 12 deals, 20% off of our gift cards. So feel free to do that. Really, for the entire site now, you can just basically do this where, let's say you were kind of on the fence for certain things. I'm not sure, for patients that don't know about what I do, but you really should just try to take advantage of it. Just like try to get a few different things, and at least get a consultation, and then we could talk about it. But get some gift cards, because most patients for their scars spend about $5,000 to $7,000. So hopefully that'll give you an idea of how much you need for your gift cards, and that's 20% off. But I see a lot of people that are current patients as well on here, and you could talk to them and see. Here's Michelle. Came all the way from Texas as well last year, I believe. And I haven't seen you in a while, actually, by the way. So hopefully I can't wait for you to come on. Thanks, Balkimi. Yeah, I did a laser. Balkimi saying my skin is glowing. I did the erbium laser on Saturday. And so you can see it's actually really, it's a matter of just a couple of days of downtime if you do it that way. I do it more for like anti-aging purposes, just to kind of get a nice fresh look. And so it looks, like it's mostly healed. It's a little bit dry still, but it's pretty awesome, because you do that every 6 months or so. You get an amazing result. Actually, I'm going to show you a patient. She's got better skin than me, actually. I'll show you this one. She started off, let me show you her. Let me find her. It's actually really worth seeing, because she had scars, and then we do erbium laser on her, as well as some TCA Cross sometimes. And I also did some Bellafill. Actually, this is really, really nice. Take a look at her result. You can see this. I'm going to pull this up for everybody. You can see. Look at that. That's awesome, right? Look at this. Really, really awesome, amazing result. Look at how smooth that skin is. So she actually just has perfect skin at this point. I mean, pretty close to perfect. She thinks that she wants a little bit of the fine lines improved a little bit more. But that's something you could do. This is something you could just do regularly every few months or so. And it's like, it is achievable. Like, her scars were not significantly deep, but they were there. They were certainly there. And she saw them. She was bothered by them. And so it's like, it's possible to achieve amazing results if you do everything that I say and follow my instructions, really. Really. She actually was on other skincare products before, things like that. I had her stop all that stuff. Today I had a patient, she had bad acne, and she was on so many different skincare products, and they were all overly drying the skin. And so it's like, these products that people spend hundreds of dollars on, thousands of dollars on, they overly dry the skin sometimes. And nothing can beat what we could do with a laser. Nothing can beat what we do with our just sunblock and just making sure that you're using the right kind of pigmentation creams, things like that afterwards. you get amazing results. So yeah, I mean, she's somebody I see regularly. This was about 4 sessions, I believe, at this point for this patient. Although I've done another session after this, but she does it every like 3.5 months or so, and you can see, look at that significant improvement for her. And you know, some people can achieve that. Some patients like to just want to just go slow, like low energy lasers, just every once in a while. In this case, what we did was we did TCA Cross. We did the first session, I did erbium laser, and then I also did a little bit of Bellafill. And then later on, we did some more TCA Cross, and now we did more lighter sessions of erbium laser. So this was actually, yes, this was only with profractional laser as well as TCA Cross. She's done about 4 to 5 sessions of TCA though at this point though. So a lot of TCA Cross as well. Will it ever become completely smooth, or will it still have that texture like the right picture? Yeah, there's no way to get completely smooth. Really, it's just not realistic. And that's one of the things I've always showcased for people as well, because I like to show just exactly what to expect depending on how deep your scars are, where we're starting. And you could get a good idea and good understanding of what to expect from that. You really cannot achieve perfect skin. You just have to just accept it. You just have to look at it and think, okay, where was I before? Where am I now? And this is something that's really satisfying for the vast majority of patients. But if you look at it and say that, you know, this isn't enough for you, then you shouldn't even go down this route. You know, you really shouldn't do it. You should just kind of just more focus on something else in life that's going to make you happier. This is probably not going to make you happy enough, honestly. And there's a lot of people that, you probably need to hear that, you know, because it's like people tell me I want glass skin, and they start with like, severe scars, and it's never going to happen. This patient, she, was shooting for really good skin, but she was also really realistic. She said, I'm always going to see some scars. I know it, but like, I just want to get as good as I possibly can. As long as you could say that I could keep on getting better, I'll just keep on working at it. And that's like the perfect approach for me, because it's like she trusts me. She trusts that I'm going to keep on working on it. And I will tell her if we just sort of like feel like we're not going to be able to do much more. But really, with low energy lasers, you could continuously get better, really. It's after we hit that enough of a result, we could kind of just keep on softening up the scars, improving the skin quality over and over again. And there's nothing that's really holding us back from that other than, your time and money. For me, when I did the laser on Saturday, I had a little bit of redness on Sunday, and today it's dry, but it's already much better. Tomorrow it's going to be better. So it's like a day of downtime. It's like, of course you should, like, to me, it's like, why not do something like that? Why would you not do that? It's like get better and better skin. For myself, it's really fun. It's really nice to have that. And I always wanted it. Like, I accepted a long time ago that I couldn't get like perfect skin. But like, I was like, I could get like glowing skin. I could get like skin that's the best for myself. And that's cool. That's awesome. I'm happy with that. Like, that's great for me. Doobie is saying, do you feel as if hormonal isn't able to recover when I keep up with mine? It almost resembles glass. I missed what you said. Hi, Trevor. How's it going? Good seeing you. I just got in. What is the procedure that made this result? This is TCA Cross, and this is erbium laser, and also some Bellafill. Yeah, this is, that mindset, honestly, is for everything, really. When it comes down to it, you may find, I had a patient today, really nice patient, and he was telling me he's trying to shoot for med school. And he went to school, and he couldn't afford going into med school. So then he had to go and be an ultrasound tech. And then, now he's doing his master's program, and then he's going to go and try to go into med school. And it's like, it seems like this roundabout way, and people could really get crushed by that. It's like that. It gets like really frustrating that you have to go around, and it's like, feels like it's unfair. And it really is unfair. It is. It's like, it is unfair that like you can't do it because, you can't go directly to med school because you can't afford it. It is unfair. It's terrible. It's a terrible system. It's terrible. But at the same time, he still had that goal, and he still stuck with it. And it's like, just because it's like a little bit longer and it's more roundabout way of going about it, he could still achieve it. And it's like, we could get like, you just sort of sometimes have to change the way your mindset is, that sometimes it's like, maybe you won't go directly into getting, as clear of skin as you possibly could, But maybe, with work, with patience, we could be able to find another way to get to something that you're going to feel really satisfied and really happy with. There's patients that I've had that wanted to go to one thing and then they ended up doing another pathway, and it ended up being like amazing for them. And it's like, okay, like maybe the thing that you thought was the best possible thing and you were so obsessed with, it wasn't the necessary, and like maybe there's another way of doing things. So it's like, I will work with you to try to get to amazing, critical beautiful results. But we also have to feel like there's a point where you just have to feel satisfied with yourself. And we could kind of look at yourself and just view it as more like something that's not visible to you day to day, not visible to your friends, not visible to people that are in the checkout aisle, not visible on dates. That's what we're trying to achieve as much as we can. That's, for a vast majority of patients, achievable. And that's realistic. But if you're trying to shoot for, I just want perfect, if I'm having a flashlight under my skin and, I'm looking at it and there's a flashlight there and I'm seeing that there's scars, well, like who's looking at your skin with a flashlight, right? So it's like, don't do those kind of things. Don't like be obsessed if you go to the changing room and you see that your skin looks like there's more scars right now and like this is what everybody sees. It's not the case. It just so happens that the store that you're at just had terrible lighting. That's all it is. And just walk away, accept the fact that that's the case. It's like, it's okay. What kind of scars are these? These seem very minimal. These are mostly ice pick scars and some boxcar scars. Yeah, these are minimal. But that's why I was showcasing that we essentially could get pretty close to perfect for this one with these more minimal scars. So it is achievable in more minimal scars. She did multiple sessions of TCA and erbium to achieve this. And Vinod is saying, is it better to get CO2 laser before or after Botox injection on the face? Well, you could do it, either option. Essentially, if you do it like a couple weeks before you do CO2 laser, totally fine. If you do it after CO2 laser, totally fine. In fact, you even could do it in some areas of the face, even the same day. I just likely wouldn't recommend doing that for the forehead area, but let's say a little bit on the crow's feet, you could do that for that same day. And sometimes I've done that if I don't want any contraction of the scar tissue area, I'll do a little bit of Botox that same day. It just all depends on what we're looking at with patients. I know I missed a bunch of questions, so I see here thoughts on pro-fractional or laser. So usually it's a lighter laser. It's not going to be something that it's just a one and done type of treatment. The pro-fractional laser I love though. Honestly, that's what I just did on Saturday. I do it every 6 months or so. But it's not for like all kinds of scars. For deep, thick scars, it's probably not going to be enough. Let's see. Sorry, I missed the first answer. Can you purchase more than one gift card in the same purchase? Yeah, you could purchase as many as you can. Some patients have been purchasing, I'll just say, some patients have been purchasing tens of thousands of dollars worth of that. So it's like they're just doing it just to get it so that they get the full year's worth. And like I think it's like, for the full amount, they'll get it there. And they did it because it's just like you could get the gift cards and just keep on tacking onto it and keep on adding onto it that way. This is the last day, last few hours of it, by the way. This is it. And we'll see, it's like, this is like one of those things that we threw at the very end because I kind of misspoke about it during the live one night. And so I felt obligated that we have to do it. I told them to do it, but we'll see about doing gift cards. Is Shani saying, is a fractional CO2 laser always safe for every skin type and condition? No, it's not for every skin type and condition. No, it's not. Like some patients, it really could cause more pigmentation issues. It's not really worth the risk, and even sometimes even scarring. How do you mitigate the risk of subcision? Well, there's a lot of different things. I mean, one is, there's a lot actually. One is that I do mostly with a lot of numbing solution in there. So basically I blow up the skin quite a bit. So I make sure it's really, really numb when I do it. And that helps because that stretches out the scars. In the old days, there's actually still even some doctors who insist on doing dry subcision. So meaning they don't do any numbing solution inside there. They go in there and they just actually try to break up that scar tissue. And they believe that actually hematomas can help spread out the scar a little bit better and separate it better. I always put too much tumescent. In fact, someone one time told me you over-tumesce, you put too much numbing solution in there, and they were like, "Oh, it's like it's a waste of the solution." And it's like, why would I care about the waste of solution if it's going to be more comfortable for patients, and we're going to be able to glide inside there and actually break up the scar tissue well. Second thing I do is that I use mostly blunt cannula subcision, and so I usually use multiple different gauges of a blunt cannula. And honestly, part of it's because because I'm a DO, I'm an osteopath, but like we really did get trained. One thing that we got trained really, really well is we got trained in our palpation technique, meaning like we could feel really, really well, feel skin very, very well, and feel skin better than a lot of people may expect. It's like I could feel it even with the cannula. I could feel that, and I put my hand on there and I could really feel that scar tissue underneath there. And so that's most of what I could do is with just blunt cannula subcision, just going underneath there, undermining that scar tissue, undermining and breaking up each of those bands. I could really properly feel it and break apart. Another thing I do, if I need to do more like sharp tools, then I'm more localized for those sharp tools. So let's say that there's an area where it's really stuck or tethered down or puckered. I'll just go right into that spot and actually break up that scar tissue really effectively that way. I'm not like a big fan of just going at it really aggressively and like doing more like a windshield wiper type of approach for subcision, instead just more localized approach for that. Have you used Cool Peel CO2 laser? What are your thoughts on this laser? Yeah, I used to use it. I actually gave it to another doctor a while ago because I like actually the surgical pieces of my laser right now. So I usually use surgical pieces, but I'm open to other CO2 lasers also. And there's a new Cool Peel laser that's supposedly pretty good. I haven't played around with it though, but there's a new one though that's out there. This was actually another result that I was showcasing before too. I'll just show you guys here. This one. Let's see if I can get this. Oops. Let's get this. Where did I? Oh, here we go. I'm going to try to show a few other results here. Let's see if I can get this one here too. Oh, well, this is actually filler. I was actually not planning on showing this one right now, but this was actually with collagen stimulating products. This is with Dilute Radiesse, mostly and a little bit in the lips, and also some a little bit of hyaluronic acid filler for underneath the eyes. Oh, hi, user36. Awesome. User36 is saying, thanks so much, doctor, for injecting me Friday. Appreciate you. Thanks for coming on. Appreciate you. And do you prescribe Accutane? Yeah, I usually do more of a low dose. A low dose Accutane is usually. But it depends on what's happening. But you could do micro dosing for Accutane. It actually works really well. I ended up doing like a lower dose. It was funny because, you know, I've told you guys before, but I was on 3 times I was on Accutane. And at my time, nobody was doing low dose, but I was actually always like looking at research and all that kind of stuff for acne. And there was, at the time, it was just started to come out like this low dose way of doing Accutane. And so I asked my my dermatologist, can we do low dose Accutane? And he was actually a very, very nice gentleman, very, very nice. And he was like, kind of a little bit like, you know, I'm not sure if it's going to be able to get to the whole thing, but I told him, like, listen, last time I was on the second time, I ended up losing my hair a little bit. I was getting like joint pain a lot. And so I really need it, but like, I don't want to go and like get all those side effects. And so, you know, I did it a lower dose, not like super low dose, but it was a lower dose, and it did help me a lot more. That was like the final time I ended up doing. 3 times I was on full doses of Accutane, and the third time I was on for a longer time. Worked out really well, but you know, I'm a big believer in it, honestly. Sometimes for some patients, it's like that's what I needed to do. Now it's like it's nice that we have other options. You know, that's what we use the Accure Laser for. But it's really tough. You know, it's like a lot of times patients have a severe cystic acne. They didn't have any access to physicians. Like this patient right here, severe scars. I'm showing you this because this is, you know, a progress report patient. He's from out of state. You can see where we're at right now. It's like there's still a lot of room to be going. I wanted to show you that. We did subcision here. I broke up the scar tissue. Still have to do more work. Still have to do a little bit more volume. Still have to smooth it out a little bit more. He's Fitzpatrick 5. So it's like you got to go and kind of work on this slowly so we don't cause hyperpigmentation, lose pigmentation. It's you know, not something that you could necessarily recover from easily. You know, yes, there's ways that we could do it and improve your pigmentation afterwards, but it's like I will try to avoid that as much as we can. What is the best laser for anti-aging glass skin? So either the Pico laser or erbium laser. Those are the best options. Actually, this patient did the Pico laser, by the way, too. I forgot about that. I was going to show this other result. I can't even find it right now. Are complications from Bellafill rare? Scared about granulomas? I deal with Bellafill probably the second most in the entire country. I've been doing it for so long, and I haven't run into any problems with granulomas, not a single problem. There's a ways of doing it. You have to keep the skin really clean when we do it, which we do. But it's not something that I've run into a problem with, though. And I've run into way more problems with hyaluronic acid fillers, especially like the Juvederm line and things. I've run into a lot of problems with that. But Bellafill, don't run into problems with it. I also don't believe, though, in pushing it, though. So if you feel like it's something you're worried about, doesn't make sense to you, okay. You read on the internet that it's not good, and like I tell you it's great, but you saw on the internet that's not good. Okay, I'm not going to argue about it. But just do something for volume to improve it. And so try something where you use Radiesse or with or Sculptra. Do those things. Try to improve those. So I'm just saying, is this after one treatment? If not, do you think this is the most improvement this patient will see? The other patient, yeah, that was a single session. He's from out of state, and that, yes, he will get more improvement. Now when he came in, we did a little bit more volume for him, so he'll get a better result there. Doctor, I have my consultation in February. How many sessions does it typically take for the scars to go away? Depends on how thick they are. It depends on how thick it is. So Matcha saying your pigmentation cream is $300. Can we buy our own and use before our treatment? No. I'm totally serious. I don't require, look at everybody else. Look at all across, everybody else are going to try to sell you thousands of dollars worth of stuff about products, all these things. I don't do any of those things. I say you have to use a moisturizer cream, you use a sunblock. But I do not have anybody with permanent pigmentation problems. And the reason why is because I prep the skin a certain way and I do things a certain way afterwards. So it's, it's for your safety. It's like, that's the thing. It's like, I do this and I do it extremely safely for patients. And I do it in dark patients who are Fitzpatrick 5 and above, many times. Patients 4 and above are the vast majority of my patients. And there's a way to do this. We could do it very, very safely over and over and over again. But I got to make sure that you're using the right products. In fact, I canceled it on a patient on Friday of last week because I saw that he wasn't using it. He didn't use it. And it's like, he was a Fitzpatrick 5 patient. And it's like he's not doing the thing. This is not the patient, by the way, but he wasn't doing the cream, using the cream. So I was like, I'm not going to be doing the laser on you. We're not going to be able to do it. And it's like, it's for his safety. We can't do it. So be honest about this stuff. Also, like I do know when people aren't honest, and it's like I don't really like it at all. One of my biggest things in life is when people aren't honest with me. To be honest with you. It's like one of the biggest things in life. And I'm actually like a human lie detector. So it really sucks to lie to me. So it's like, I really am. It's like everybody knows. I'm a human lie detector. So it's like, I sit there, you may not know that I know that you lied, but like, I know you lied. And it's like, don't do that. And I have gotten rid of patients on my I've gotten rid of them before because just like they lie sometimes. Like most people don't, it's there's a very, very few that don't, that have done that. But like, there's some people that do. There's some people that just make stuff up. And it's like, I'm trying to help you. I'm trying to get you the best possible skin. I'm trying to avoid complications and pigmentation issues and things like that. So just follow what I say. I will get you amazing, excellent, beautiful results, but follow what I say. And then we can get there. We'll be able to get there. Like, don't do it like where it's like, get something from someone else or like use something else and like, and think you're going to get the same kind of results. And like, honestly, it's like my work speaks for myself. I have so many results and like so many people just come on here all the time. Here's user 36 saying, I love your staff. Thank you so much and everything. It's like, I appreciate you, by the way, user 36. And it's like, I appreciate all of you guys, but like, and here's Priya. Thank you, Priya, by the way. Good seeing you too. And it's like all these people that are coming on and it's like, I want everybody to like have great, beautiful results. And there's a way to do it. We're going to be able to get there if we follow the instructions. If you go to other people, though, there's people that are going to try to sell you like thousands of dollars worth of skincare products. They do. I wish they didn't, because it turns out you didn't have to. It turns out that you don't have to have thousands of dollars worth of skincare products in order to get the best possible results. It turns out that what they were saying was fake. It was not true. Let's see here. I haven't had a consultation yet, but I want to get by the gift card. Is there a way to estimate costs? Well, for scars, most patients spend between $5,000 to $7,000. And then if you need more things or volume, things like that, expect it to be a little bit more than that. So always feel free to get that there, basically. What's our info? You can go to my page at our profile. You just go there directly and you can be able to go to drkazi.com there and we'll be able to help you out with you could check out, you could get through all of our prices. Everything's just online right there. Chosen for DNA saying, I would never get filler because of the migration and the risk could be permanent. And so, yeah, then, you probably aren't going to get the results like this patient. This is a patient that did Bellafill, and you're not going to be able to achieve that. And that's okay. Just sort of really accept that you're still going to get volume loss. This patient, if you look at this is why I was showing this actually, because if you look at this, he had fat loss from scars. He has normal good fat elsewhere, and then he had fat loss due to scars. The area where he had severe scarring is where he had the little bit of indentation there. So I did do tailor liberated subcision for him. I did break up the scar tissue, but it was still actually indented. So we had to do something for it. So that's where we did something where we did volume for us. And so you have to do something like that. So again, I don't try to argue with patients. If you feel like it's like something not for you, you don't want to do Bellafill, you don't want to do filler, you don't want to do whatever else. I'm full of it. I believe in it. I strongly believe in it. It's like I have tons of vials of Bellafill on my face. It worked incredibly well for my face. It was amazing for me. But sure, if you don't want to do it, okay. But I just accept that you're not going to be able to achieve full results without volume. And volume is a big, big factor in how I do these things. And it's like, I do believe in long-lasting fillers. I do believe in things that are going to continue to improve the skin quality. I don't really love things that are just going to just do like a quick fix. I just do hyaluronic acid filler and just kind of walk away from it after that, because it's you think it's going to solve your scars. It's going to be like continuous. My patient earlier, like for a consultation today, she said she did HA filler, just lasted her 3 months, and that's really a lot of times. Myra, I will have my team reach out back to you. If you just DM us, I could try to see what the situation is about reaching back to you for that callback. So I'll have them do that then. But we do get a lot of messages. So I'm not sure when you sent it to us. We get a lot of messages, and I will try to make sure that we can get back in a timely manner for you, though. But bear with us for a little bit there with that. MT saying, after subcision, do you typically perform a fat transfer to fill the same scarred area? Yeah, we could do that. Absolutely. I don't believe in doing it the same day for fat transfer, though. I know there are doctors out there that do subcision and fat transfer the same day. I think you really should question that. I really do. I think, first of all, those doctors, I've actually treated their complications. It's like something that I've seen a lot where they've done subcision. There was one patient that they did it on, and he had like these big balls underneath there of fat. And it wasn't the first time that happened. And so it's like, they did subcision, and then they placed the fat, and it wasn't in the right spot where they put the fat. It was basically probably too superficial, because after you do subcision, everything's undermined. There's a bunch of tumescent, there's a bunch of solution in there. I don't know where you're putting the fat, dude. I don't know. It's like, where are you putting that fat? You don't know where the fat's going. And like, maybe you're lucky sometimes, but like, it could be a disaster if you're not lucky. It could end up causing like that big chunk like that. Hi, Maxwell. How's it going? We are located in Newport Beach, California. Let's see here. And by the way, Soul Matcha, I hope that answered your question, by the way. Hopefully that helped you out that. Is Shani saying, what kind of laser is generally safe for targeting pigmentation and scars? I've heard Pico can be pretty safe. Pico is not going to be helpful for most scars. Unless it's like just post-inflammatory hyperpigmentation, it's not going to help for most scars. Is there any risk or side effect for treating deep acne scars? Yeah, there are. There's a few different things that could happen. It's mostly with pigmentation issues, but nothing else with that I've encountered. Just temporary pigmentation issues is the biggest factor that I had. But if you go to somebody who is not specialized in this and doesn't do this enough, then you can run into more complications. You can run into people that do subcision really recklessly, TCA Cross really recklessly, a lot of different things that could end up happening that could be catastrophes for people. Would you say that Q-switch laser is good for dark surgical scars? It's good, yeah. Q-switch is good. I usually use a Pico laser, but Q-switch is a good laser actually. So I like the fact that they're at least doing that instead of doing microneedling or something like that, which I've seen a lot of people just kind of be pushed microneedling, and it's like that's not going to help enough for scars. Why do you use Minitox versus Botox or Dysport? I think it's important to clarify. Minitox is just the way I do it, just to allow some expression. But I use mostly Dysport in my practice. I use Dysport actually. Just so you're aware, I use Dysport. Some patients I recommend also want Xeomin. So they ask me to do Xeomin, but most patients I do Dysport on them. Does Bellafill wear off? So basically, the way Bellafill works is it's 80% cow collagen, 20% PMMA, and essentially what ends up happening is that with that cow collagen, it does start to go down over the course of about 3 months or so, and your body then learns how to make collagen around it. So that's how it really works. Is that basically it's like teaching your body how to make collagen around the PMMA. The PMMA though continues to stay there. Let's see your smiley face. If more than 3,000 is estimated, is it possible to buy another gift card after the consultation? Yeah, you can get it at the full price. A gift card will still be available at the full price. But this is the last day that we're doing a 20% off for. This is like the only day that we do it. This is a flash sale for 20% off for a gift card. You know, if you want to get it later on, you could absolutely do it at full price. I would recommend just getting like a lot of people, or just get like a bunch of gift cards. You can always give it to someone. That's the point of the gift card, actually. It's actually supposed to be as a gift, but it's okay to give it to yourself. So just go ahead and get it that way. It's on their site. I'm obsessed with it for silicone tape. Yeah, silicone tape. I love it. I sleep with it all the time. It's also good just to like help with mouth breathing and things like that. I recommend it a lot. Silicone tape. Really highly recommended. It's underutilized in my mind, I think. Not enough people use it. What brand is it? I don't live there for free shipping. For silicone tape, I think it's just like a medical brand that we use. What do you recommend to control cystic acne and to get rid of scars? Well, to control cystic acne, you really should be on some sort of oral medication, or at least for a little bit, for like an oral antibiotic, usually some sort of topical antibiotic. If it's really true cystic acne, you may need to be on either Accutane, or we could use something like the Accure Laser. So either option. But cystic acne, really treat it urgently, really help. Actually, my patient earlier today, she had severe cystic acne. She didn't even want to see the photos from before, but she knew that was so much better at this point. And now we're treating her mild scars. Actually, it's amazing because she had severe cystic acne. We did the Accure Laser. Now 4 months out, she's acne free, and more importantly, she hardly has any scars. That's awesome. So I love the fact that we basically solved her, not just her acne, but also in a way her scars, because we prevented her from getting new scars. That's awesome. Very, very mild, superficial, and it could have ended up being a disaster, actually. It could have been like just something that ended up having severe cystic acne, could end up causing bad scars. And so it's amazing to be able to see that the significant improvement in her skin with just a few sessions, just a few months, and now she doesn't have any really very, very mild scarring. There's another patient, actually, I just want to show severe cystic acne. We did the Accure Laser. You could see that she doesn't even have any of those or really very, very mild scars at this point. So awesome. That's a really nice process, actually, because here's somebody who could have had really severe scarring due to her cystic acne, and instead we were able to avoid that with the Accure Laser. So awesome. Love it, because it's like, even though I do scars all the time, I really don't want people to go through that process. I really don't. It's like there's years and years and years of work that needs to be involved in getting great skin. So it's like amazing if we could avoid it. What did you end up using for her mild scarring? This patient you're talking about, I can't remember which one, because I'm showing a few photos there. I don't know which one you're referring to. The other patient though was just there was one patient I showed, which was just basically a little bit of TCA Cross as well as erbium laser. Do you have before and after with the same lighting? Yeah, I do it all the time. That's what I've been showcasing all the time, the same lighting. I don't know anybody who shows the same lighting as this one, actually. I show like the same lighting over and over and over again. It was actually really hard. For several years, I was not able to be able to get that in our room. Like, it was really tough to figure out how to get great lighting in our office. We had a very small office before. It was really tough. And so it was really nice to be able to showcase that for our patients, that we finally had it. And like, I knew when I was going through this whole journey, this whole process, that I really wanted results that like were just an accurate representation for scars, for people to be able to see that, okay, this is what we could get if you have severe scars. This could be your journey, and hopefully it gives you some clarity about, okay, well, there is some hope out there. There's things that we could do to improve things. It's not as hopeless as everybody says. There's a lot of people out there who think that there's nothing you could do for your acne, for your scars. Someone who's asking for someone with more severe scars. I'll try to pull up someone right now. I switched over my computer, so everything became a big mess. You may be noticing that's why I've been flipping through things over and over, because I got mixed up with all my slides and everything. got mixed up here. Oh, actually, this is a good case. I haven't showed him in a long time. He's actually a really good case. I just saw him recently. He's looking so good. He's actually someone from years ago. Actually, a really nice patient. Actually, coming all the way from Puerto Rico, I believe. Let's see if I could. So I don't see him too often, but I saw him recently. He was in town. Where did he go? Here. Let me see if I can find that photo again here. Because that's a really good case, actually. I'm going to try to find this for you because I just saw him on my page. And then for some reason... So I'll give you a moment here. Why don't you guys tell me what things you want me to pull up, because everything got mixed up, and I'll try to showcase that for you if I have time. Or if not here today, I'll try to do it this week. But I'll show you some more results here. And this patient actually is awesome. So I'm definitely going to try to figure out how to format this guy's. Really nice patient, actually. Really, really nice. And it's like one of these things that you look at and you think, okay, this was really amazing that we were able to achieve this. This wasn't a single session, though. I'll tell you that. This was, where did our thing go here? Let's see. I think this is oh, here we go. Perfect. I am going to blow this one up here for you. And then you can see for yourself. Look at this one. This is a really, really nice, impressive result. Amazing. I saw him recently again, and he's just like, he's such a good guy too. Really, really nice patient. He was somebody who just, like it was just bothering him. He was in school, and it just felt like it was just like not himself with his scars. And it's like he just wanted something that can give him some more confidence. He just wanted more confidence in life, and it's like we got that. And you can see him now. He's beaming. He's super happy in life. And, sometimes he comes on. Actually, he doesn't really say too much on the lives, but he comes on. I see his name every once in a while. So if you're on, feel free to. I don't know if I saw you right now. There's a bunch of people that came on, but feel free to shout out. But really amazing for him. This is a very, very severe case. Very severe case. It took a lot of work. It took about 3 or 4 CO2 laser sessions. It's been a while, actually. We did this years ago now. So I can't remember offhand. I got to double check, actually. The TCA Cross multiple times, some Bellafill multiple times. So it was a lot of work. He did a great job also with sun exposure. He's actually a Hispanic Fitzpatrick 4 patient, although he's lighter skin here, but he is somebody who could have pigmented really badly. So you can see, look at that. It's amazing, amazing improvement there. Hopefully everybody could see that. I think I should be formatted okay. Are there before and afters taken with that machine used during your consults? Yeah, some of them are. So we have a few different ways of doing the before and afters. We do the Vectra images, which you can see some of the scars. Some of the ones are the other camera that we use for box lighting. And then we also have this Visia machine for like pigmentation. You could also see some of like the boxcar scars as well. So we have a bunch of different ways of standardized lighting, and that's how I do it actually. I wanted it so that things were just more standardized. This was definitely, so he had a few things that were going for him. One is that he's actually, I think at the time he was just 21 years old. So really relatively new scars too for him, even though it was very, very severe scarring. But it was also relatively new. And he was a little bit lighter, even though he's a Hispanic patient, he was lighter. He's somebody who got sunburned easily and way before he tans. So I was able to push it pretty strong actually for him. And each time I actually did do more ablative CO2 lasers actually for those thicker edges of the scars. And that ended up helping quite a bit for him. So I think it's like, these kind of patients, these kind of results, it's like, it takes work. It's like, it's not really something that like you just say, okay, well, this is like going to be a one and done for everybody. It could take a little bit more work. You see a lot of times I show progress reports. This is a patient from years ago. I got to double check. I wasn't actually planning on doing this, but someone asked this for like more severe case. So here you go. More severe case right here. This is with also a lot of volume too. We did Dilute Radiesse. We did Bellafill for him. I also worked on with the TCA Cross, and I believe I did a couple excisions as well. Yes, I did actually for that deep scar right over here. I remember I did an excision for him there as well. So a few different things that we had to do for this patient. This is very, very deep, thick scar tissue for this patient. Younger patient Fitzpatrick 4, but he's somebody who was very good with sun exposure, and otherwise his acne was really under control too. So you can see. is definitely a more severe case, but like we get there eventually. It's just like takes more work sometimes. Deepco is saying, how many sessions do you need to see improvement? It depends on how thick the scar tissue is. You know, it depends on what we're looking at. Sometimes I showcase results that are just in a single session. Some people have it just depends on how thick the scars are and how many sessions we need. Is going to be completely variable. It really depends on the type of scars that we're dealing with. So a lot of this, I do find that these are complex scars in most patients. But when it's more like rolling scars, it is a little bit easier sometimes because we can actually break up that scar tissue and put some volume in there. And that gets pretty close to, you know, not perfect, but like it's significantly improved that way. It's possible if you do subcision really properly, appropriately, and then you put some volume in there, you're going to get pretty close to it. So I think that a lot of it depends on the types of scars, but the ice pick scars could take a lot longer. That takes several sessions there. Miami's saying I did 6 months and the results are not like this with different doctors. Yeah, you know, it's everybody's variable. First of all, I don't know many people in the country or in the world that do scars. You know, that many. There's not that many, and so I think that plays a big role in a lot of this, and how they do the treatments and how focused they are and how determined they are at getting the best possible result. You know, it's definitely possible. It just depends on your skin type. It depends on your collagen response. It depends on a lot of different factors, your sun exposure, things like that. A lot of different things can factor into it. Plastic surgery doc is asking, hi doc, what's your specialty? Are you a dermatologist? No, I'm not a dermatologist. I specialized in internal medicine and I went back into the world of procedures for scars because I realized that it wasn't done properly. It wasn't done properly for myself. It wasn't done properly for a lot of patients. And I was like, you know, there's a way to do it properly. There's a way to do it that I could actually break up scar tissue really effectively, really safely. And I was treated by dermatologists. I was treated by a lot of different people. And I found that the results were pretty much nothing. I wasn't even going to say mild. It's like a lot of times it was just nothing. It was like good for like a few weeks and then it was gone. And so it's like, it was sad. You know, I spent thousands of dollars of my own money and I did that. And it was like, I hardly had much of an improvement there. So yeah, I ended up doing this because I found that there just wasn't enough, there wasn't enough things that were improving these scars. And the people were just obsessed with lasers. They're obsessed with just doing that over and over and over again and microneedling, things like that. And none of those things were helping. None of those things were working on scars the way, manual work was. The way we did it with Subcision, the way that we did it with TCA Cross, Excision, those things. So it's like, even the laser. I want you to actually sometimes, you guys should watch my laser videos, like the full ones. We have a few of them on YouTube. I think there's a few more that are going to come up. Just watch it, honestly. Actually, maybe it's like ASMR for some people, but watch it. You'll see, watch and see if you've ever seen anyone do laser the way I do laser. Just see it. I don't know. I've seen some people out there that do lasers, things like that. And like, maybe there's some people out there now that do it, but like, I've never seen anybody do it that way. And it's like, to me, it was very intuitive to do it that way. Maybe because I had scars and I kept on looking at my scar and thinking, how would I solve that scar if I had a tool? And I was like, why not look under certain lighting and like really finely burn down the edges there? Why not do that? Kind of wild when you think about it, the fact that that wasn't done that way. You'll see everybody says, just do multiple passes of the laser. Just do that over and over and over again. They'll tell you all these crazy settings, all sorts of stuff, and do this. And it's not about the laser. It's not. I don't care what anybody says. I've used so many different devices out there. It's not about the energy devices that you're using. It's not, there's a way of doing it. You gotta be really precise when you do it. Very, very precise. And you don't just bulk heat the skin. You don't do that. And especially for darker skin types. And that's why so many people kept on saying, well, you can't treat darker skin types. You can't treat it. You just have to live with your scars. You have to accept the fact that you have scars. That's what everybody was saying. So many people were saying that. You have to live with your scars. All my life, I was hearing that. Like, just live with it. You're just like, it was as if it was like, I was crazy for having scars, like for scars and wanting to just solve my scars. I was just like crazy. Oh, hi, Humble Warrior, by the way. How's it going? I recognize your profile photo there. Good seeing you. Hope you're doing well. Let's see here. So yeah, I mean, I found that there's so many people out there that were suffering from these things. And people were saying there's just no solution. Oh, there's just nothing you can do. There's nothing you can do. Just got to live with it. That's what you do. And to me, it's like, I really do believe every single problem has a solution. Now, sometimes there may be different pathways to get to that solution. Sometimes it's not going to be the kind of solution necessarily that you may have liked, but there is a solution. And it's like, it turns out that people didn't do TCA Cross properly in this country. And it wasn't until I showcased it over and over and over again that people stopped bothering me about doing TCA Cross. Everybody kept on saying, why don't you do phenol peel or phenol cross? Phenol is supposed to be superior to TCA, this and that. Or TCA just always widens scars. TCA does this, TCA does that. And it's not true. It's just not the case. It's like, you got to do it safely. You got to do it carefully. You adjust the concentration depending on the scar. And it's like, what they were saying was just not true. And because I was in this world, because I dealt with it, because I had that, I knew that the stuff that they were saying just wasn't true. And it turns out so many things that they say is like this consensus of people say this and that. And it's like, it really isn't that much of a consensus. It turns out it's like one dude like 40 years ago said something and they're like just like repeating it over and over again. Like, it's just like, this is it. This is the truth. This is all it is. Don't even question the science anymore. Don't question the science. How many times have you guys heard, don't question the science? And it turns out like, it's like the science was wrong about so many different things. It's like the science is wrong about what's in our food right now. You know, it's like, they said our food was healthy and it's like, it turns out it's not that healthy. So I don't know, you know, like, don't trust necessarily what these guys are saying, like double check and see, okay, is it actually like, you know, is this verified? I don't mind it with people like, question certain things. It's like, it's totally valid. I don't want to push things. I think everybody should have the ability to have free will and make informed decisions and like really think about things and really it makes sense to them and they understand it. And I hope that's what I'm able to achieve for you guys, that I'm explaining to you in a way that it makes sense for you. But if it doesn't make sense for you, that's okay. You know, like never worship your leaders, you know, like just, it's okay. Like that's okay to do. Like just find something that makes sense for you. I think that this is the best possible way for us. This is the best possible way that I know of at this point. But I do know that things evolve. Things change all the time, and I'm more than open to like seeing where that goes. As long as it's safe for patients, as long as we could do it without causing a catastrophe in patients, I'm open to exploring those things. It just has to be within a reasonable limit, and I'm always going to hold myself back for patient safety. So it's like, I want the amazing result, but I still have to make sure that the patients are safe, that we're doing it. We're not doing experiments on patients. We're not going to test something out. We're not going to push it to a level that could be dangerous or risky for patients. So that's just never going to be the case. I'm never going to be that guy. And like, there's a lot of people out there that will be. There's a lot of people I've actually encountered and seen that done it that way. I just never been my style. Hello, doctor. I have a question, please. How many times can a person do subcision, and what is the standard period between each session? In general, I like to do it just really well under a single session. That's usually what I like to do. I don't like to do multiple times. I really don't, because it's an aggressive procedure. It's an invasive procedure. I think you really should do it very, very effectively, thoroughly under a single time. This patient with the severe scars that he has, he did it under a single session, one time. You don't have to do it multiple times. It's not true that it retethers, and I've seen this patient now years and years later, and it's still excellent, still amazing. He just needs a little bit of volume, but other than that, he looks amazing. I don't believe in doing invasive procedures over and over. That's why I also don't do aggressive ablative lasers multiple times also, or I stretch it out like every 6 months or a year or something like that. You don't do things like over and over and over again with scars, or just in general. Like, honestly, it's just, I don't know why you would do the same thing over and over and over again for a lot of things. I can understand for some things that just takes a little bit more time, like pigmentation, it does. Tattoo removal, it takes more time, things like that. But it's not going to be something you just do one and done, just like that improperly, and then you say, okay, well, you know, now we look at this and you say, well, I think it maybe we have to do more subcision. Well, maybe you should have done it well the first time, and maybe you should have like learned how to do subcision, or maybe you shouldn't even touch patients because you can't do it properly. I see some of these guys, honestly, I feel like I would never trust my family with them. I would never do it myself. Most people, like there's so many people, like sometimes patients tell me, I went to this doctor and I keep quiet about it, but like I wouldn't trust that doctor for my face. I wouldn't. I don't know. Like I just wouldn't. I've dealt with their problems and things like that. I just wouldn't trust them. And so it's like, I don't know. Did you look at the results? Did the results make sense to you? Did you look, like I had a patient the other day. She got like all this excess filler done, and I knew who did it. And I was like, you know, who did the work? And she goes, this person. And I was really looking for a more natural result. So I said, when you looked at the injector, did you think that she was natural? And she goes, no, she looked really puffy. And like, she couldn't even smile. Like she looked okay from like a certain angle, but like she can't smile. And so it's like, that's like the red flag right there, right? So it's like, this is the person that you're going to for a natural look, and they're not able to smile. So it's like, don't you want to smile? Like, so like to go to people that like showcase things and do things, you know, at a high level, and like you can see their work and it makes sense to you. Honestly, like I believe in like always growing, always improving. So if you feel like there's things that we can improve on, things like that, I'm happy to learn. I'm happy to work on it, happy to get better and better and better at things. My goal in life, honestly, I'm open to it. I always want things to get better. And so if you guys look at things and you say, well, there's something better out there, I look at it. I actually do look into it and say, well, maybe there is something that's better. Maybe I'm missing something. I'll take a look and see if there's something better and better. And I'll look at it and better and make myself better, because my goal in life is to always improve myself and improve other people. That's actually my whole mission in this world, is that everybody gets better and better in this world and just continues to grow, continues to get better and better. And like we look back one day and we're gonna have a much better world if everybody just looks better, like not looks better, but like just like grows and gets better in the world. And it's like, you know, if we could do that in a small little way with scars or with pigmentation or with facial balancing, awesome, that'd be great. Right? That's really, really cool. We do a little bit of that. Monica saying, Dr. Qazi, I did the acne scar, TCA, Subcision, Erbium, CO2. So happy with the results. Thank you, Monica. But Monica, you got to let me share it if you haven't. Well, maybe, or just let me know. You know, if we could see the results at some point. Or maybe you did already. I'm not sure. But if you did, let us share it. Appreciate you. Oh, you're Fitzpatrick 4th. So perfect. That'll be all the better if we could share it. I don't know. When was the last time we saw you for results there? Candy Casper is saying, hi doc, is there a different option if you don't want fillers, Bellafill? You could do fat transfer. Fat transfer is totally fine. If you have volume loss, we could absolutely do fat transfer. I would love to do something for your volume though. What do you recommend for a facial laceration scar that's a bit atrophic? So I usually do want to still do Subcision there, and you probably need to do some sort of volume, something like Bellafill, for example, Sculptra, Radiesse, all good options for that. But you do need to do Subcision usually, even for a laceration scar. Usually there is something where it's pulled down or tethered. Oh, User36, you're the one that did Accure and Bellafill the same day. Awesome. Now I know who you were. Thank you so much for that. I was able to fit you in. Appreciate the fact that I was able to help you out with that. And I'm glad you love your results already. Let's see here. Elena's saying, hold up, my dad has that. Is it genetic, and what is it called, and why is it like that? Well, yeah, people can get acne scars genetically. That is true. It's possible. It could happen, actually. You could get, not everybody with acne gets severe scars. It's unfortunate. But if you haven't had, scars like this, and your dad has it, it's possible you're not going to get it. That's awesome. You know, it's not necessary that every single person with acne gets scars. And also, it's also important just to realize that it's not true that everybody gets these scars because they pick at their face and things like that. That's not the case at all. Really, a lot of patients, vast majority of patients actually don't. What's your approach to Subcision? Okay, let's repeat this question here. Sharing is caring is saying, what's your approach to Subcision to avoid sagging? Do you go in near the scar or by the side cheek? So it depends on the different, there's different ways. It depends on where the scar tissue is. If it's, more lateral, then we'll go closer to the scar area there. If it's like, a little bit below over here, I'm usually kind of come along and break it up over here. It just depends on where it's happening. Sometimes if it's like along the jawline, we'll go on from just a little bit underneath here with a blunt candle. It depends on where the scar tissue is. Usually for most patients, I try to do mostly a single entry point though. I typically do it that way. So I do a single entry point with Subcision, and I mostly do with a lot of numbing solution in there. I blow up the skin quite a lot so I can stretch out the skin, stretch out the scars. So I can stretch out the scars so essentially I can go in there, glide up and break up the scar tissue. I've done so much Subcision. In fact, I'll tell you, there's a person that was saying that he does so much Subcision and gave me the numbers for the Subcision, and was saying that he did that over the course of like the last, I think, a lifetime or something, like the last 5 years or so. And I was like, that's I do that every 3 to 6 months or so. That amount of Subcision. So, and we run into zero problems with sagging. And one of the reasons why is because we go in and break up that scar tissue really meticulously, just in certain spots that we need to. And then if we have to use certain blades, we'll go in at those particular pockets. And I was talking about it earlier, but I really do have to say that it's about palpation. You're feeling the skin, you're feeling the scar tissue, you're feeling it as it's breaking up, and you're feeling with your cannula. As you're doing that, you can really then push in and break up that scar tissue. Awesome, Monica. Monica said that she saw those amazing results just after a single session. Awesome. I look forward to seeing, when are you coming in for your second session, Monica? Let's see where we are. Do you recommend, do you recommend Bellafill for forehead scars? Usually I use more hyaluronic acid filler initially for forehead scars if it's a big indentation, and then plus TCA Cross. I don't know if Moonfox is on here. Michelle Moonfox, I don't know if you're on here, but she just messaged me earlier saying that she's super happy with her forehead Subcision and filler that I did, as well as TCA Cross. She comes in from Texas. I don't know if you're on here still, but if you are, there's a question about forehead filler, if you could answer that. What can you do for liposuction fibrosis Subcision? Yeah, you could do Subcision for that as well. You could do that as well. Sometimes you may do actually a little bit of radio frequency as well. Danielle saying, what are your thoughts on HA filler expanding over time? I've seen a lot of videos, and it's possible. It depends on the kinds of filler, depends on the placement of the filler. Usually I don't use HA filler for scars though. So it's just my preference. For the forehead though, you could use HA. I don't run into any problems with it because I mostly dilute it really, really well. So it spreads out really well. So I don't run into any problems with it expanding over time. It's already actually expanded in a way because I've actually put a little bit of saline in there to help spread it out. I do that on purpose so that way you don't run into that problem down the line. What was the question? The question, so Michelle's saying the forehead filler makes me look more feminine. What was the question? No, just about, they appreciate it, just about forehead filler. Is it helpful for scars? And so it sounds like it was for you. Thank you. Seeking Desire saying, are fillers always necessary after Subcision? Can they be done without? They're not always necessary. No, they're not. Sometimes you actually could just do Subcision and you don't have to do filler. I will tell you if you need to. But a lot of times there is a big chunk of fat loss. There's a volume loss there, and we have to do something for that volume. And that's where something like where we do Subcision, and then ultimately we may have to do a little bit of filler there. Is this progress after one session? No, this was after multiple sessions for this patient. We did do ablative CO2 laser a few times actually for him. We did also Dilute Radiesse. We did TCA Cross. We did Bellafill as well. So we did a few things. And we did excisions as well for him. Can you do Subcision every 6 months, or one time is enough and continue with other techniques? Just do it one time properly. And by the way, this is I actually ended up going really long actually tonight. But last night for our gift card sale, hopefully you guys took advantage of that. Hopefully this is the night to do it. Just do it. $5,000 to $7,000 for most patients. I'll tell you, this patient was more than that. This is going to be more about like $12,000 to $18,000, probably maybe $20,000, just so you know, for this for something like this, probably close to around that. Just to give you an idea, hopefully that helps clarify things. He did it for over a longer period of time, but it's severe scars for him, and he needed a lot of volume. He had a lot of volume loss there. So, but also I did it before we had our. So you guys know, by the way, I don't know if everybody knows this. I'll tell you for those that are still on here that for future sessions, it is up to 55% off for laser and TCA Cross. So just so you know, that was something I added last year, I believe, and so. That's a huge saving. So like additional sessions, like I really do want so that it's more effective. I had patients like this, but like he was able to go through the whole journey. But there are some patients who it's like, I was doing it and just they couldn't afford more treatments. And it's like, I really wanted just to get this better and better for them. And so I was like, I'm just going to do things as much as I could. As much as we could, we just want to get this to that. So yeah, the future sessions are like up to 55% off with TCA Cross, with laser. And so like, I don't know anybody else that's going to do that. I'll tell you that. It is 55%, meaning like I think some things are like sometimes there's a sale for something like that. But yes, you will, if you had it like locked up that way, it is. But sometimes, Michelle, at some point, for the people that are coming on new, things like that, it's like it may end up changing. Let's just say that you ended up getting it at a time when we're doing it that way. But I leave it open because at some point, someday we may not be able to do it that way. I don't know. And like my board, it's not just me actually involved with this stuff. So it's like my board was like, we have to have it so that there's room to be able to change that in the future. So get your things now, and right now at this point in time, up to 55% off for future sessions. So there you go. So it is really actually 55% off right now. But in the future, it may change. It may be that we don't do it up to 55% off. I don't know. But so do it now. Like just get things now as much as you could, because it's like future sessions are 55% off for lasers and TCA Cross. If the scars aren't as bad as just very little, could one session treatment fix it? Yes, I'll have a lot of results that are just in a single session. Is there a better tip for Accure? No, they have not had you're talking for your nose. The one that we have is for most noses. But if you're looking for a smaller one yet, they haven't gotten that approved just yet though. It is something I was actually looking to see if I could try to get something smaller, but kind of in the process. I have so many other things, so I kind of pushed that to the side this year. But I will try at some point to try to get that so we could get for your particular nose, we could make sure we cover that. But that's actually, most people now have found it really comfortable on the nose. So I haven't heard anybody who said that there's a problem with it. I don't know anybody that did a Accure recently. People have said that it's more comfortable. It's not really much of a problem. So hopefully that's the case for you too if you end up doing it again. OZ saying, is subcision harder to accomplish on forehead versus cheeks? For forehead or cheeks, cheeks is definitely easier. Forehead, it's okay. It's not too hard. I just only use blunt on the forehead. Oh, user 36. Yeah, that's right. I did Bellafill, and then you did the Accure Laser that day. User did it on the nose. So yeah, I think that I got to double check actually for my team. I think there is something that they did that was different for the nose actually. And so I got to double check, Michelle. There is something that they're using now that made it so that it's the one you initially had it there. I think it was a little bit wider. So I think that it's a little bit narrower now. That's why it's fitting for everybody else. I'll double check to see from our team though for that. But definitely, everybody's been saying it gets complete now. There's no problem whatsoever with the nose or anything like that. And part of it's also, I think, the amount of energy that is coming through with the amount of air that's going through there. Do you have more before and after pictures of the skin for Accure? Yeah, I could do more tomorrow too. It's on our page also. I'm going to be signing out tonight because I have to take my dog out for a walk and then just enjoy the rest of my night. I have a bunch of cases tomorrow too. So I'm going to wrap up here. I loved all the engagement though. A bunch of questions, tons of things. Love it. You guys know this is the last day right now and our gift cards are on sale. So people are asking the terms and conditions. They're on our page. Everything's just open on our page. Just all of our prices, everything like that. Just go for it. Do you have a promotion for Botox? Yes, just do the gift card sale. It's 20% off. Do the gift card sale. Everyone should just do a gift card sale. Just get a membership. Actually, I don't even know. Are you allowed to do that? I'm not even sure. Maybe you get a membership too. I just threw that at the end there. Maybe you can. I think you can do a membership, which is like unlimited Botox for the full year, and you can do that with a gift card. Maybe there should. I don't know. Maybe they lock that up. Maybe you should. Can you tell a little bit about the procedure to use fat instead of filler? Does fat last longer than filler? Well, it could. It gives you more volume, but 50% of it does go down over the course of a year. And usually you want to use a little bit of nano fat too to help with the stem cells there to improve the skin quality some more. How long does the redness and pigmentation remain after a serious session? Could be like 3 months. This patient, he was red for about 3 to 4 months, I believe. So there you go. Yeah, Michelle, I'm not sure actually. I'm not sure if they locked that up. Maybe, I think you found the loophole last year too for some things, and I think they locked it up this year. But there's just 2 hours left for the gift card thing. If you're debating between the price, 3,000, 4,000, 5,000 gift card, most patients spend $5,000 to $7,000. I gave you an example. Here's a patient with severe scars. His was probably about $12,000 to $18,000 or so for his scars, and it's he had a very severe case. And it's held up really well. Wait, the half off deal is today only. This is 20% off for the gift card, and it's today only. This is it, and that's what it is. It's 20% off for gift cards. So feel free to get the gift cards. Fat transfer for hollow temples versus Sculptra. It's actually going to be Sculptra. Yeah, I will say that this was something at the last moment that we ended up doing because I accidentally mentioned it on the live, and then we weren't too sure, but like a lot of people asked about it, and I was like kind of like, oh shoot, I guess I did say that. That's true. So you guys do remember what I say on the live, and so it's like if I said it, it's like, and sometimes I'm like, oops, I guess I shouldn't have said that, but there we go. When would you use Erbium and 1-CO2 for scarring? Are both okay for darker skin? It could be okay. It depends on how thick it is. It depends on how thick it is there. Oh, it's a firm. A firm is basically you go on the website and you can actually just do a firm it's pricing. It's basically like a care credit way of just spreading, or just basically a way of spreading out your payments. So very little. Yeah, Sculptra is on sale as well. Sculptra is on there, so feel free to get that though. All right, guys, I will see you all tomorrow night. I will help you out tomorrow night. It's going to be a bunch of fun stuff. We'll showcase the rest of this week. Let me know if there's any particular questions you had. We tried to we did a lot this year. It was an awesome year, by the way. I'm actually debating if I will do it during the do the lives a little bit during the holiday or not. I'll just double check on that. But for sure, this week I'm doing it. We'll see kind of like the next couple weeks after that though. But I'll be for sure back on next year. I'm going to see about like kind of what I'm going to be doing though. Okay. Anyways though, so this week I saw